deadly side effects are on the rise in one of the most widely prescribed antibiotics on the market. I-Team investigator Jackie Calloway first exposed the dangers of Cipro and Levaquin back in 2015. And new tonight, she reports on the fight to raise awareness of one less known risk of taking these drugs: suicide.
Happy birthday to you.
She was larger than life.
49 is the last year.
No one, not Don Mendoza's husband of 21 years, or the two daughters she loved fiercely, imagined those words would prove true. In a million years, did you ever see your wife taking her own life?
She's fine for 27 years. No attempt of anything, no depression.
7 months after her birthday, Mike Mendoza came home for lunch and found his wife at the bottom of their pool.
She had lashed herself to a chaise lounge and rolled herself into the pool.
Mike blames the powerful and commonly prescribed antibiotic Cipro for Dawn's death.
Like Tuesday, bad anxiety at night.
Dawn journaled her downward spiral in the days after a doctor prescribed Cipro for pneumonia.
Since Thursday, September 12th, I have slept only on Monday. Insomnia, anxiety, racing heart since Thursday, September 12th.
And texts on her phone indicate Dawn notified her doctor's office about the anxiety and insomnia. Did anyone say this might be the Cipro?
No, never.
In the search for answers, Dawn read the Cipro drug insert and found anxiety, insomnia, and suicide warnings on page 12 of a 52-page insert.
It says, feel like I'm dying inside out.
The woman who cherished her girls and loved life ended her suffering 4 days after taking her final dose.
911, what's your emergency?
She parked her car on the side of the interstate and walked in front of a semi.
Deanna Pogan's family also blames Cipro for her suicide.
It was not her. She would have never, ever, ever done something like that.
Reports filed with the FDA tied 219 suicides to Cipro and Levaquin, two popular antibiotics used to treat serious infection. The FDA says only between 1% and 10% of all adverse side effects are ever reported.
And the FDA should revise the package label.
Dr. Charles Bennett, a nationally recognized medication safety expert, petitioned the FDA in 2014
fluoroquinolone-associated toxicity,
and again in 2019 for increased suicide warnings for Cipro and Levaquin, a class of drugs called fluoroquinolones. In 2018, the FDA issued its strongest black box warnings for these drugs. It states the antibiotics are associated with disabling and potentially permanent side effects of the tendons, muscles, joints, nerves, and central nervous system. But the agency denied Dr. Bennett's petition to add suicide as part of the boxed warning, leaving it as a subsection on page 12 of the package insert.
And physicians and providers do not still have any idea about the side effect.
In an attempt to raise worldwide awareness, Dr. Bennett started work on another petition. It will ask the CDC to recognize fluoroquinolone long-term toxicity as a condition that can be billed to insurance.
Biggest way that people say to get providers to pay attention is when they can bill for an incident.
But the process could take years. Meanwhile, the makers of Levaquin stopped making the drug, citing other options for treatment. And this week, Cipro's maker Bayer responded to us in a statement. Fluoroquinolone antibiotics treat a wide range of bacterial infections. The Cipro label already contains FDA-approved language advising physicians and their patients about the potential side effects, including specific warnings about the risk of central nervous system and other psychiatric effects.
Good job, Mom.
Victims' families say more needs to be done to warn patients and inform doctors of the potentially life-threatening risks.
Gets on this drug in 7 days and takes her life.
I'm I-Team investigator Jackie Calloway, taking action for you.